Assalamu alaikum and welcome to the Dr. UT lectures. In today's lecture, we will discuss with you guys regarding kidney stones. And remember guys, this lecture is going to be very simple and everyone can understand inshallah. So we will try our level best to make things simple, okay? Well, in this lecture, what we are going to cover, first, let me tell about that. We will talk about how kidney stones are formed and how the pain is actually generated and what is the mechanism of the pain. And we'll talk about the causes, risk factors, and somehow we will talk about the diet. Especially here we'll discuss with you guys about the rice. It is very common that people say rice is actually supposed to cause kidney stones. Well, we will talk about this very particular and very common question. Well, next is we'll talk about the signs and symptoms and diagnosis. And after that, we'll talk about the nutshell. Means we'll summarize the entire lecture and we'll tell you the very interesting point that will help you guys regarding this problem, kidney stones, and some other health issues as well. Well, so first of all, let's talk about the formation of the kidney stones. How the kidney stones are actually formed. The very beginning, the very first thing. Formation. First, you guys must know that we have two kidneys in our body, and those two kidneys are having some kind of tubes known as ureter, and these tubes are actually moving towards the urinary bladder, and then at the end we have urethra, from where the urine is actually discharged. So first of all, let me tell you how the urine is formed. Well, the blood is actually filtered inside the kidney, and when we just take this one kidney and we zoom it, so we'll get this kind of structure. So inside which we will observe such kind of circular shapes, and inside there will be such kind of tubes being seen. The tubes are known as nephron. Now this nephron, and there are several nephrons, and these nephrons are actually the functional units. Okay, so this is actually the functional unit, nephron. Now what it does is simple. The blood will come through this particular tube, and then it will be filtered, and at the end urine will be formed, and that urine which is formed will be directed through this ureter and will come here in the bladder and will be stored for a while, and at the end of the day it will be moved out. Okay, so this is how urine is actually produced or formed or synthesized. You can use any word hereby. So I'm trying to use the word that is actually easy for you guys to make you guys understand about a particular point. So well, now what happens hereby? First of all, let me tell a little bit more about the nephron. In this nephron, what is happening? It is actually filtering the blood. Okay, and from that blood, it is just producing the urine. Then, and then that urine is then forwarded towards the ureter and urinary bladder and then moved out. And in the meanwhile, in this filtration, it is actually managing or regulating our body fluid and electrolyte. So you can say in short, it is maintaining the electrolyte balance in the body. So what happens when sometimes the balance actually fluctuates or it moves so high? So then what happens? The higher concentration is actually filtered from this particular portion of the nephron known as glomerulus. So when it is moving through these tubes, somewhere in the tubes, it may stick. After it sticks, so it then starts accumulating more those particular electrolytes, especially if we talk about the oxalate, okay? Because it is the most common cause, the most common stuff responsible to cause kidney stones. So what happens in the beginning? It is actually only a dot hereby, and very small stone is there. So with the passage of time, when there is excess of this oxalate in the body, so that will come and will start accumulating here, accumulating. This accumulation will lead towards the formation of a stone, and this stone can and may become larger. So when it is in the smaller shape, it may pass easily from the blood, from your body, and via urine. With the urine, okay. So when it is becoming larger, so then it is very difficult to move the blood, move that particular stone via urine. So it cannot be passed in the urine easily. Then we go for certain medication therapy and some other therapies, okay. Well, so what is happening here? We're talking about the formation. So when the electrolyte balance is actually changed, so this electrolyte will start accumulating hereby. The more it accumulates, the more the shape of the stone is actually changed. Means it is becoming harder and stronger. So remember, this stone can be formed in the nephron, and then as it is formed, it can move further, and stones can be formed here also in this particular region of the kidney, and it can be if that kidney stones move actually, they can also block this ureter. So what happens is it blocks the particular portion of the tube or any tubule or any portion. So then that particular stone starts sending messages. First of all, remember this point. So as this particular stone is in the particular tubule, so this, as it starts moving, in the meanwhile, as it is moving, so it is actually generating a pressure on the wall. Now here we have one side of the wall, and here we have second side of the wall. So when something is moving through the pipe, through a hole, so what is it doing? It is actually generating a pressure thereby. So when you start moving something bigger than the diameter of the pipe or of the lumen or something, so that particular thing will observe. Suppose like if a snake is actually engulfing something, okay, snake, you can observe, anybody can see that something is moving inside the body of a snake. So if thing is that much bigger, okay, if thing is that much bigger, that that thing is actually irritating or stimulating the wall of particular thing. So mainly, if we talk about the wall of the nephron and ureter, so what will happen then? Then that will actually generate some messages. Now those messages are actually of the pain, and then that messages will be transferred to the brain. Okay, so messages can go from here, so from any region can reach to the brain, your head, your brain. So now these messages are very several type of messages, means they are very strong type. So they can cause you a very strong feeling of the pain. So you can forget yourself because of this pain. Okay, so means in short, these are very strong type of pain, not acute type of pain. These are very strong type of pain. Okay, so well, remember guys, the pain always appears when the stone is actually in the motion. As the stone starts moving, so the pain will then start generating, and you will feel the pain. And this pain is of very strong type, not of simple type. You will forget anything because of that pain. Then may Allah protect us, everybody of us. Well, so this is how the pain is generated. First of all, we got the formation, how the stone is formed. The mechanism was very simple in front of you. The stone is formed because of the disbalancement of the minerals and some electrolytes. In short, we can say when those disbalance actually exceed, so then they start accumulating in the tubule or somewhere in the kidney. So then that accumulation will start further calling some more minerals, and that accumulation will actually enlarge, and the stone size may increase with the passage of time if we don't concentrate on the treatment plans, or if you don't follow your treatment plan. So well, then this was actually the formation, and the pain was that when the stone starts moving, the pain then starts generating, and the pain is of very severe type. And now let's come towards the cause or the risk factors of this particular pain. Simple. I told you there are certain salts, there is protein. If you are using a protein-rich diet, remember guys, oxalate, calcium, uric acid, sodium, potassium, phosphorus, etc. Means there are several minerals and several stuff available which can cause you the kidney stones. May you be safe from the kidney stones. And well, so if you're talking about here about the topic, I just want to make this topic clear to you guys. So well, there are certain salts that can cause protein-rich diet, and medications are there. Remember guys, you guys are taking medicine for a very simple type of pain. When there is seen to you, you just take medicine. Remember guys, those medication like NSAIDs, sodium, or any other medicine that is containing sodium and calcium and some other medications are there, so which can cause you kidney problems. My dear, always consult your healthcare provider, especially pharmacist, because everybody is approaching the medical store and or the pharmacy in the very beginning of the pain if somebody is having. So when you go to the particular pharmacy where there is no an expert doctor available thereby, doctor of pharmacy should be there in the pharmacy. If there is no doctor of pharmacy in the particular pharmacy, if you take medication like such kind of medications for the particular pain, that pain relieving medication may exacerbate, means that may worsen this particular kidney pain. And if you don't have pain and you are taking medicines like NSAIDs and some other, these medicines are responsible to cause you life-threatening problems in the future, especially like kidney problems may be seen by you guys. So avoid medication without consulting your healthcare providers, especially when you are in the early stage of the pain. You guys actually always go to the pharmacy, and if there is not any expert doctor available thereby, I am talking about doctor of pharmacy. If there is no doctor of pharmacy available thereby in the pharmacy, please don't take medication from the person who has just got a simple degree of metric or FSC or something like that. So please always consult doctor of pharmacy regarding medication point of view. If you're not consulting, you are actually destroying your future. So means you're actually welcoming the future complications, especially the complication regarding the kidneys and some other. So always take medication, consulting your pharmacist when there is any worst kind of health problem, and always consult expert physicians and expert pharmacists. Okay, do not take medication from yourself. Self-medication should not be taken. And as well, if someone says to you that I got this medication, I got relief from the pain, please don't follow this also. This is also a kind of self-medication. Always consult your pharmacist, your physician regarding health problems. Okay, well, obesity is also the cause of this particular problem. There is kidney stone. And regarding these, we got some interesting points. Now the fourth point is regarding the question that rice is supposed to cause kidney stones. And a moment earlier I told you guys that kidney stones, when you take 100 patients, out of those 100, 80 patients, okay, 80 out of 100 will be having stones. Those stones, when you examine, you will find thereby a stuff that is known as oxalate. Okay, so those stones are called as oxalate stones. Now looking to this, let me tell you guys about the nutritional constituents of these three things: rice, spinach and almond. When you take the rice, when you examine oxalate in the rice, you will get 2 to 10 milligrams. In short, you can say only 10 milligrams will be seen in the half cup of the rice, and the same half cup of the spinach you will find 755 mg of the oxalate. What of the oxalate? Oxalate. And if you take about 20 or 22 almonds, in short you can say this much almond, if you take, that actually covers your palm. So when you take this much almond, what will happen then? You are actually taking 122 mg of the oxalate. You are actually taking this much oxalate in this particular concentration. So now those who are saying that kidney stones are actually worsened by taking the rice, now just concentrate the concentration of the kidney stone causing thing, that is oxalate, in all these three things. The half cup of rice contains 10 mg, and the same half cup of the spinach contains 755 mg, and the same cup of the amount of the almond, like 22 or 20 or 30 amounts, they contain 122 mg. Now just look at the concentration. Oxalate is very low in the rice as compared to spinach and almond. What we are doing is, this is our really very problem. We actually spread the false things so very much. We don't spread the positive things. Now people will not spread my lecture to your friends, because they have got something positive hereby and don't want to share the positive things with others. Please, brothers and sisters, everybody, try to spread the positivity all around. Now this is the positivity in front of you. Here is the concentration. What we have spread in the community is that, please don't take rice. You are getting a kind of complications with this, that is especially the kidney stones will generate with this. My dears, 80% kidney stones are actually because of the oxalate, and here is the concentration of oxalate in front of you. When you just thoroughly observe the nutritional value of the oxalate of all these rice, spinach, almond. Well, anyways, whatever you're taking, if you are not a kidney patient, and if you're afraid of taking rice, spinach or anything, try to follow this very rule. That is, always take a very small and good quality of food. Always when you increase the concentration of the food, you will actually lead yourself towards complications. The more you increase the concentration of the food, the more you will become complicated. Means you are actually giving complications to your body in the sense of absorption, digestion, absorption, and so on. So I told you hereby, so when you are obese, you can also have kidney stones. So well, always take a proper amount of food and don't fill your stomach till this portion, okay, till nose. Always leave a particular portion thereby. Take all the stuff, whatever is there, whatever you find halal stuff, so take that and enjoy that, but not to the full, okay. So it is actually told, this particular rule is actually for every one of us, and this is the rule that has been taught to us 1400 years ago by the Holy Prophet Muhammad sallallahu alaihi wasallam. Well, if you get time, always go through the Quran and the Seerah of Prophet Muhammad sallallahu alaihi wasallam, because you will get a lot of rules that are actually, when you follow those rules, in short, when you follow Allah and Rasul, you will get the benefits of dunya and hereafter, okay. Well, next we have is regarding diagnosis point of view, signs, symptoms, and diagnosis. Well, diagnosis is often done based on the signs, symptoms, and some have through tests. Well, what we do is hereby, so well, people can have pain. I just told you that pain will be of very severe type, and along with that there will be fever, nausea, vomiting, and frequent urination. Means urine will be of very frequent time and again urination, and pain during urination, and sometimes blood may be seen in the urine. So as the stone is moving, so that stone actually damages the particular tube, and due to which the blood will be seen thereby at the end of the day. And well, so there will be some kind of smell, different type of smell will be there, and the color of the urine may be changed from the usual. Okay, and some extra tests are performed thereby, X-ray, ultrasound, CT scan, and some blood tests may be seen thereby. Well, nowadays X-ray is not that much beneficial because of the stones location and stones formation and stones stuff like that. So well, it is another business, another topic, another discussion. Anyways, so certain tests and X-rays and stuff like that are actually obtained for the diagnosis of the particular complication, that is kidney stones. And once again, the nutshell, that is actually, please eat small but the best quantity of food, okay, and always pray, because what is the reason behind thereby? That is وَإِذَا مَرِضْتُ فَهُوَ يَشْفِينِ. That's it, okay. Say happy. Allah Hafiz.